As of right now, I'm declaring a state of emergency for Albany County. It's in conjunction with the governor did March 7th, but with the president doing it last night, and where we're headed, we're going to have to, I had to declare state of emergency for Albany County so I can move resources around and necessarily address the issue as we continue to go on. I'll be still working with other people in government, but we're going to be moving at a quicker path. So I thought that was going to be the big news for today after last night, but unfortunately, as the night went on and this morning, we have the fifth case, fifth person now who has been tested positive for the coronavirus, who is at a local hospital right now, who is being treated. That's all I can tell you on that right now. Dr. Whalen can't be here because she's dealing with that situation. And obviously we're mapping and tracking everyone that this is touching. There are a total of 135 individuals being monitored right now, You got to remember how many you think you touch in the media and multiply that person times another person times another person. That's including the 75 people under mandatory quarantine. We're up to 75 people right now that are mandatory quarantine. We were at 60 people under precautionary quarantine. That dropped down to 47 right before we started. And that's why I said this is going to change. But unfortunately, we're going to head in the other direction for a while. And I hate to say it, this is going to be the norm. It's here, folks. I said this before. Testing ramps up in New York. There'll be more positive testing, as they said yesterday. The state talked about they were going from X amount of tests to 6,000 a day. That means we're going to be testing more and more people, and unfortunately, we're going to be adding probably more numbers to this, or more people being mandatory quarantine and people voluntary quarantine. Dr. Whalen wants to be here, but obviously her staff is working around the clock. So I also want to say to everyone on that case to the thing, part of the state of emergency, we have the medical corps that falls under the Department of Health, under our office, and these are volunteer medical personnel, from doctors, from nurses to LPNs, you name it, anyone that wants to volunteer for situations like this. We've been practicing this for the last 8 years I've been in office, and we've been practicing this since the beginning of time, since we started the medical corps under the health department. But I will say this, and this is out to your viewers. We could use volunteers. We could use people that want to answer the phone. We can train you in 10 to 15 minutes. We're getting a lot of phone calls, and that's why I say to your viewers, to your listeners, please go to the CDC sites, go to a news media site, go to a site that you can trust. Stop reading everything online. Stop it. Stop reading Facebook. Stop reading the internet that tells you there's a cure or these are the signs and symptoms. And if you feel sick, call your doctor. That's been the new protocol. All the hospitals got together yesterday. We've been on the phones with all the hospitals and everyone else. Call your primary care doctor, tell them what's going on, and they're going to direct you in the right direction. But again, unfortunately, fear drives a lot of this. And I'm saying to everyone, take a step back, take a deep breath, and just evaluate your situation. Again, I hate to report, there's another person positive as today. The difference is this person is getting medically treated. We don't know if they're going to be admitted. We don't know what's going on at this time. Dr. Whalen's on top of that. So we'll put a briefing out later on that. But if anyone has any questions about the state of emergency or about the fifth person, please.
Is this an individual who's employed at the Eddy Village Green in the city of Cohoes?
We don't have any of that information right now. We're just dealing with the situation, and again, we're mapping and tracking that individual. So we will not know. I can't confirm or deny anything like that.
If I could just answer that.
Can you identify yourself?
Sure.
I apologize.
My name is Daniel Lynch. I'm the Deputy County Executive. In regards to the newly confirmed case, we literally learned of it moments before walking into the previous precedent. So Dr. Whalen and her staff are doing a full background investigation. As far as status or location or community, we're unsure at this time. we will be updating the press with new information this afternoon.
What exactly is a state of emergency? How do things change?
How do things change? Well, it gives me the authority to move services around the county without having to go through the proper channels. It gives me the authority to reach out, which we had been doing anyway, with all the town leaders. It helps me, obviously, end up being like an instant command structure where I can just take our resources, put them where we need them, shift departments that, okay, listen, I can shift these people to the Department of Health to help out with this crisis, and we can address this situation, and it helps me with procurement policies where, I don't have to wait to go through the proper channels. I can just go out and do what we need to do.
Does that last indefinitely?
No, I'm going to sign one. Obviously he signed it, and it will be out, and we'll probably redo it every 5 days. We're going to, like I said, this is the new norm. It's going to be evaluated on the situations, but if you look around what's going on in the state and other places between different areas of I don't even want to get into what we could do because I don't want to have everyone panic. But it just gives me the power to have to do what we need. And one of the cases is like our DSS, anyone coming in for social services, we're closing it down, but we got, we worked it out in the state because you usually have to be in person. You can't do it over the computer and you can't do it over the phone. We got permission to do that now. So now the people can call in, they're still going to get their benefits. We're going to be closing our county buildings outside visitors other than necessary business that has to be conducted. We're looking at changing the way our operations are going with non-essential employees and other things to address this issue, to get people home. But most importantly, too, address the issue that the schools are closed. We've been working with all the superintendents, and we have a lot of families that don't have daycare now or don't have a place to put their kids. So we're addressing all these issues as we go forward, and the state of emergency will help me do that.
I just need to circle back. If a
Yes.
person that you guys have learned that is confirmed with the coronavirus and they do work in a public setting, what do you do for all the individuals that are there? Not saying that this is happening
No,
right
we
now.
treat, I'm sorry, I didn't mean to
Yeah.
stop you. I'm sorry about that. I was just anticipating the rest of your question. The same thing else hospital did. We're going to have to put them in place and quarantine them right there. We have the protocols. Unfortunately, right, no one wants to hear we've been practicing this for years. Not just the coronavirus, but an incident like this. We're ready, and that's the same way we'll address it. That's why I shut my nursing home down before the governor even said it. It's outside visitors. The only people getting into our nursing home are, unfortunately, if their loved ones are at the final stage of their life. We're making special things, but we're, same thing like Albany Med's doing, and St. Peter's are doing, Memorial Hospital's doing. Ellis, did is that we're making people fill out forms that come in. We're checking their, all their symptoms to make sure, and we're isolating them in different areas of the nursing home. So if they are, it doesn't spread, because obviously this is more vulnerable to seniors than anyone else.
So if I could just add to that response,
Yeah.
our county executive. Part of the background from the Department of Health is coming into contact with all those that may have had exposure with a confirmed case. And that's a tedious and very time-consuming process. And the county executive has declared a state of emergency, which will allow county resources to be pooled internally to the Department of Health to make those contacts with those individuals that may have been in contact with a confirmed case. But there's also a call here today for volunteers to assist the medical corps. We can always use assistance in placing those phone calls and alerting folks that may have had contact so that the Department of Health can take the precautionary measures necessary to mitigate and contain this spread.
And the other thing we're trying to do is not bog down the 911 system. So if you have a question, that's why we did the partnership with United Way. You can call 211 and get questions answered there. But people are bogging down our mental health department because of what they're reading online. And that's why I need volunteers to help answer the phones. We have shifts going around, obviously, all morning, starting at 8 a.m. and going to 11. We'll be going to 11 o'clock at night, and probably beyond that throughout the night. We've been working down there anyway. So pretty much around the clock, 7 days a week, and we'll continue to address this as we go forward and give you the updates as we go forward, if wherever way the numbers go.
With the primary coming up, are you expecting this to affect the board of elections at all?
Here's the thing. The governor's looking at right now of suspending petitions, for candidates to get on the ballot. and Louisiana just canceled their primary and moved it out, I would recommend, listen, our primary is not until June, so we might be all right, but I wouldn't be surprised if this continues on through June, the governor moving it out. That's least of my concerns right now. My main concern is the health and well-being of the people of this county.
The new patient, do you have any information on whether the new patient, do you have any information on whether they traveled out of the country, had contact with previous patients, anything you can tell us of that?
No, everything's been changing through the night. We've been tracking other people that have been concerned about for other reasons, and I've been waiting for them tests to come back, and that's been the ongoing thing, and then this one just happened. That's why Dr. Whalen is working on that, and again, as we get that information, we'll put out what we can. I'm not trying to be disrespectful to the media about not saying where they work or what they're doing. We don't want to panic, and again, that's why we do mapping and tracking. We go to the people that they're in contact with, and we go beyond that circle to see, we're going to notify you. We're going to say, hey, you need to come in. Like I said, there's 135 individuals right now that we've been in contact with, and that number is probably going to be well over 250 by the time we're done tracking this other thing of having to come in and say, we want to test you, or do you have any signs or symptoms, and who have you been in contact with? So it takes time.
In regards to the new patients, sir, we don't have the information right now. We will provide it, but there's also a delicate balance with these individuals' privacy rights. So as we have information that can be provided to the public, we certainly will, but it's in consideration of those privacy interest rights as well.
And we've been updating all local officials, superintendents, on a conference call separate to what the governor and everyone else has been doing, just dealing with local matters. And obviously, I asked the sheriff to open up the EOC for his end of it, because they can order supplies, the hand sanitizer, whatever people might need throughout the county. So that's a great partnership. But again, it's this state of emergency for Albany County is going to be to address the resources, because we're moving fast in different directions, and we got to tackle this quickly. Any other questions?
Can I ask something on behalf of parents that
Yes.
have just raised this to our attention, right? So it was announced that there's a young person who's been infected with the virus. If students in that school think they know who that is, like, what are they supposed to do? Like, people...
Well, that person's right now under mandatory quarantine,
Right.
so they're not out, and
Right.
that's why I said that number of 135. We're reaching out, we're addressing who these individuals have contact with, and we're tackling it. And that's what I'll say to the parents. I know everyone's nervous. I know kids, parents that have kids that have asthma, have grabbed me when I'm out, walking around, or I stop to get something to drink, and they're like, hey, I got a question. My kid goes to the farm and they have asthma, and I just got over cancer. I'm like, look, just take a deep breath. See how you're feeling. Don't get yourself worked up. Call your doctor, or call, I tell them to call 211 or call the Department of Health, and we'll get you through this. It's no sense, and I'll say this, do not go to the emergency rooms if you don't have to, but Albany Med has, and I commend Jim Barber for his leadership in this, and the doctors there. They have the tent set up outside, and they're going to be addressing people as they come through. Obviously, as federal money comes through, other countries, as you see, do the drive-through. I know hopefully in the state we'll get to that too.
I would just add one thing. We don't treat individuals who suffer from colds or flu any differently. We shouldn't treat anyone who's a confirmed case of coronavirus any differently. There's precautions that they're become aware of, and for the most part, accounts back from the health department, they've been following those recommendations and continue to do so.
Not that I expect you to do so, but can either of you elaborate on, what the most difficult conversation you might be having behind closed doors that we're not privy to?
No. I'm kidding. Listen, thank you again, and we will put out that information via email or a press release. We're not, I'm not going to try to drag you here if I don't have to. But again, this is a changing situation, and this does help us get our message out through the press. It's easier, it's not like everyone, I wish they were clicking on the county website, but they're not, so it's easier for us to get the information out so we can make it out and get it out to the people. But I'll say to everyone, please don't panic. Please do not panic. Thank you.